Hello and welcome to this video from the 5-Minute Exam English channel. If you're planning to take the Occupational English Test, this could be an ideal video for you. The idea for this video is simple. I'm going to introduce 8 questions that you can use in OET role plays. These questions will help you to sound professional and caring. I can't promise that you'll be able to use these questions in every role play, but I can promise that they will be good for many situations. Now, I know that in OET role plays, you might speak to a patient or the carer of a patient. However, in most cases in this video, I'm just going to use the word patient because it's quicker. Question 1. How would you like to be called? This is a polite question to ask after you have found out the patient's name. If you ask this question, you will sound respectful towards your patient. For example, if your patient has given their name as Robert Jones, you can ask this question and then the patient can say, "Please call me Mr. Jones," or "Call me Robert." Question number 2. What brings you here today? This is a great question to ask if you have come to visit the patient. If you ask this question, the patient will be able to tell you the problem that they have. But be careful. If you are visiting the patient, for example on a home visit, this question won't make sense. Always read your roll card carefully to find out if you are visiting the patient or the patient is visiting you. Question number 3. How can I help you? This is a simple question, but it's a good question. You can use it if you are visiting the patient or the other way round. However, always read your roll card carefully. If your roll card gives you information about the patient's basic problem, then this question will sound strange. Question number 4. Do you have any concerns about your treatment? In some role plays, you have to talk to a person who is taking a course of treatment. If you ask this question, you'll be able to find out what problems that person is having with their course of treatment. Question number 5. What do you already know about this condition? In some role plays, it's necessary to find out what a patient already understands about a particular disease or condition. If you ask this question, the patient will be able to tell you what they already know. Question number 6. Did I explain that clearly? In some role plays, you have to explain something complicated, like a procedure. This question shows that you care about your patient's understanding. Also, this question could give you an opportunity to clarify anything you feel you haven't explained very well. Question number 7. May I ask how the accident happened? Some role plays focus on an accident. You could be talking to a person who's been in an accident, or you could be talking to the carer of a person who has been in an accident. This is a polite question, but also it's quick and direct. And here's the final question, number 8. Are there any more questions you would like to ask? This is a great question to use at the end of a role play, especially if you feel that you have missed something important during the conversation. And that was the final question. I hope you enjoyed this video.